Whether you have a rural clinic many miles away from a city center, an after-hours emergency room, or even a community-based outpatient clinic, if you are dispensing prescriptions, you need to provide the same standard of care as a retail pharmacy. Are you looking to improve compliance, especially with the first dosing? Are you looking to improve safety and accountability over your floor stock? Have you ever wondered how to get troops back to their units faster? Then you need to discover PickPoint's intelePharmacy Remote Dispensing System, or RDS.
The doctor at the end of an appointment basically knows what the prescription is going to be needed. They can start that process while the patient is checking out so that it's a little bit less time consuming.
When you're feeling really bad, especially if you've got the flu or anything that you've got where you need a prescribed medicine, the last thing you want to do is hop in your car, go to a pharmacy, sit there for a while. This way here they can stay in, especially in the winter. You don't even have to go outside in the cold.
With its intelePharmacy RDS, PickPoint has been supporting rural health, public health, Indian health, as well as the DoD and VA healthcare systems for over 15 years. Let's take a look at how PickPoint's provider dispensing is accomplished. First, the patient visits the clinic and the provider prescribes the medication. The provider then prints the patient-specific prescription label from the pharmacy management system, such as CHCS, Cerner, Epic, Vista, or RPMS. The provider then retrieves the patient-specific prescription label and begins the scanning process in the RDS IntelliWare. The provider scans the patient-specific prescription label and provider ID badge, triggering the medication to dispense from the RDS cabinet. The provider then retrieves the medication from the RDS cabinet and scans its barcode to verify that it is the correct medication while validating lot number and expiration date. The provider then affixes the patient-specific prescription label to the medication and dispenses it to the patient, answering any questions the patient may have about the prescription, thereby providing the same standard of care to the patient. PickPoint's intelePharmacy RDS is also easy to maintain. IntelliWare software establishes inventory par levels, creates replenishment reports, and even prints repackaging labels to automatically help replenish medications in the cabinet.
In my opinion, it's a great idea. Everybody should have one. It works very, very well. The providers like it, the nurses like it, the patients are very happy with it.
You have to have a system of checks and balances to make sure it's the right medication strength. And PickPoint has set up a system where that can actually be easily obtained.
We aren't storing or transmitting any patient data, therefore we are definitely HIPAA compliant. Anybody that needs to be able to dispense medications at point of care needs our system.
Oh, this is beneficial for anybody. Rural, city, it's anybody who has a health center or any kind of facility, doctor's office. It's great for them, great for the patient.
We actually provide the same standard of care that you would find in a retail pharmacy.
Patients have gotten in contact with us to tell us how much they appreciated not having to go to the pharmacy and wait. They didn't feel well, it was quick, it was easy.
We've been doing this for a long time and we've won many different medication safety use awards, and we've been able to provide healthcare to many, many people.
So if you're looking to better serve your patients, try doing so at the point of care with PickPoint's intelePharmacy RDS.